As we transition to the next portion of this informative webinar, I need to share this disclaimer. The views and opinions expressed by the guest panelists and/or presenters do not reflect the views or opinions of the Delta Research and Educational Foundation, DREF Research Matters for All of Us, the NIH All of Us Research Program, or any of these organizations' affiliates. And now, see, I'm smiling again. And now, I am going to introduce you to our esteemed panelists for tonight. I am going to start with Dr. McIndoll St. Eloy. McIndoll St. Eloy is a graduate of Florida State University, receiving 3 degrees and completed his MD in 2016. Dr. St. Eloy went on to do his residency at Jackson Memorial Hospital and became chief resident during his time tenure. Postgraduate, he took his first attending position at the University of Miami, and prior to completion of his first year, became the medical director over the UM Jackson Urgent Care and weathered the storm during the pandemic. Currently, Dr. St. Eloy is a medical director in geriatrics at Chin Senior Medical Center, where he continues to serve his community. What drives him is that he grew up watching his mom care for nursing home patients, and he vowed to make a difference by forming meaningful relationships. And like his mother, patients are much more than a diagnosis, says Dr. Eloy. They have unique stories and history, which influence their daily life and care. I love when we find what helps them reach their goals and maximize their potential. I'll ask my volunteers, please spotlight the presenters as we call them up. Next, we have Dr. Dapo Eloyamade. He is a preventive cardiologist at Miami Cardiac and Vascular Institute, part of Baptist Health. Dr. Dapo specializes in preventative cardiology, clinical lipidology, and cardiovascular imaging. He is fluent in English and Yoruba and conversational Spanish.
You could have called me.
Prior to joining Baptist Health in 2022, Dr. Dapo served as a non-invasive cardiologist at the University of Miami Miller School of Medicine after completing his fellowship training at the same institution. He holds a Master of Business Administration from Plymouth State University and is a fellow of the American College of Cardiology, where he serves on the board of the Florida chapter. Dr. Dapo is passionate about furthering the field of preventative cardiology and has developed a program and algorithm to detect heart disease at its earliest stages in patients with diabetes. Talk about research matters for all of us. Dr. Dapo. Next we have Dr. Maxime Olivier. He is a Haitian American who grew up in Miami, Florida, before attending Florida State University for his undergraduate studies. He remained at Florida State University for both his master's degree in biomedical science and his medical degree. He completed his internal medicine residency, where he matured his love for cardiology and was afforded the opportunity to join as one of the first classes of fellows to start the cardiology fellowship program at Orlando Health. In addition to invasive cardiology, he has interest in resistant hypertension in minorities, especially in the growing Haitian community and the surrounding counties. I present to you Dr. Maxime Olivier. And we're going to bring all of this together with a familiar face. Our discussion is going to be facilitated by none other than Dr. Tydra L. Anderson. She is an Opelika, Florida native, and she is now in her 9th year as Chief Medical Officer at Memorial Hospital Miramar, recognized for its outstanding quality, safety, and service. She values the team approach, leads by example, and empowers her team to always do what is right. An honors graduate from Miami Palmetto High School, Duke University, and the University of Pennsylvania School of Medicine, this Alpha Omega Alpha Honor Society initiate completed her obstetrics and gynecology training at the Hospital of the University of Pennsylvania. Dr. Anderson was honored as a March of Dimes Philadelphia Woman of Distinction for improving the health and wellness of women, children, and infants via successful community outreach programs. And 25 years later, received the 2021 March of Dimes Woman of Distinction Award for South Florida for invaluable contributions to healthcare and the community at large, especially the most vulnerable. Fueled by her passion to continually improve the community's health, particularly those that are most vulnerable, Dr. Anderson serves and gives with excellence to many community organizations, including Alpha Kappa Alpha Sorority Incorporated, the American Heart Association, and as a charter member and president of the Broward County Radiance chapter of Top Ladies of Distinction. I turn the floor over to Dr. Tadra Anderson.
Thank you, Lakeisha. I appreciate it. It is so good to be here with this distinguished panel of gentlemen. So good evening again, everyone, and gentlemen, good evening. Happy Black History Month, right? Let's start it with there. And happy Heart Health Month. So it's my privilege really to moderate this crucial conversation with you, distinguished gentlemen, in a much needed conversation. As we heard during the opening part of the program tonight with the icebreaker, heart disease is the leading cause of death in the United States, 1 in 4. But actually here in Florida, the numbers are even a little bit more scary, as I'm sure you gentlemen already know, where in some communities like our own, it reaches up to almost 30 to 35%. And Black people, unfortunately, we are much more likely to die of heart disease. So this panel, not only is it timely, it is necessary. So we appreciate each of you for giving your time here tonight to educate us, but also, gentlemen, to empower us. So remember that you are here not only to educate, but to empower, because we want everyone here in the listening audience to take something home with them personally, but something also that we can share with our communities. So can we all agree with those ground rules? All right, great. So let's get our conversation started with, sort of the basics, I would say. So Dr. St. Eloy, you've joined us. Why don't you give us an idea, just a quick overview about what heart disease actually is, since we're talking about heart health.
No, thank you, Dr. Anderson, for having us. It's definitely a pleasure to be on this platform and really share important information regarding to heart disease, especially in the African-American minority community. Heart disease is kind of complicated, right? There's so many different avenues that you can really look at it. Two of the distinguished cardiologists on here are actually two of my friends. So I've known them for, years in training or years in medical school, and nobody better to really explain heart disease than them. But just in a global scheme, really, heart disease is the buildup, really, of plaque, either from cholesterol in either your vessels that really supply the heart. That's kind of just in the nitty gritty without getting into so many details. Over time, everyone will eventually build up plaque in the heart, no matter who you are. You can be the best athlete, you can be the best swimmer, you can run as many miles as you want, you can eat as healthy as you want. But unfortunately, over time, all of our body breaks down, right? It's a natural occurrence the moment you're born, right? And so over time, your blood vessels get weak, they don't beat, or they don't expand or collapse the same way that they did when you were 18. Then when you're 65, as you get older, debris, cholesterol builds in the blood vessels, and over time that can close, right?
Okay.
If they close enough, then the blood doesn't necessarily get to the heart. And so that's when you start developing things like heart attacks. It could happen in the brain, cause strokes. But that's just kind of like a general idea of when you're talking about heart disease. But there's other things associated with heart disease, but we're just talking about the buildup of the vessels that can cause heart disease.
Excellent. Well, that's a great foundation for us. Dr. Olivier, can you expound a little bit? You know, we talk about, people say heart disease, and a lot of times, you know, when we're talking about that with our patients in a healthcare setting, they're thinking just about the heart. But I heard Dr. St. Eloi say that it's vessels and other things. So perhaps you can take it one step further in terms of talking about heart disease in terms of more globally beyond the heart. What can you share with our audience?
Yeah, well, first of all, good evening, and thank you for having me. I like to tell my patients, you know, if we broke down cardiovascular disease, it's cardio, but it's also vascular. And just like any part of our body, it has to get blood, and it's blood by this master pump, which we call the heart. And the heart is like a house, right? It has a plumbing, it has a structure, function, doors, valves. It has an electrical system as well. So when you have this multifaceted structure that's feeding blood to all these organs, they're intertwined and collected. And the same process that happens, like Dr. St. Eloi was mentioning, that plaque can build up in the vessels in the heart. It can also build up in the vessels in the limbs. It can build up in the vessels in the brain. It can build up in the vessels in the kidneys. And this presents itself in different ways. Unfortunately, not everything is as striking as a heart attack, as something as painful as a heart attack. And sometimes heart attacks aren't painful. Sometimes strokes and hypertension and disease in the kidneys and the eyes. These are all things that kind of develop over time, and in the form of hypertension or hyperlipidemia or high cholesterol rather. And these can all affect these different organs differently. So it's very hard to kind of bring such a very broad and detailed topic into one summary. But if I had to put it on one thing, is the heart is the pump that supplies the nutrition and the nutrients to all the organs. And when the heart goes down, because of factors that also affect the vessels, all the other organs get affected as well, whether it be immediate or chronically.
Excellent. Okay, well, that gives us a little better foundation, a little bit more detail. So Dr. Dapo, and I'm going to pronounce your name as best as I can, Iluyamade, right?
Yeah.
I like that red Baptist. I love the red for Baptist for Heart Health Month. When does all of this start? So we've talked about what heart disease and sort of globally cardiovascular disease, that it really does include the muscle of the heart along with the blood vessels in the heart and beyond, other blood vessels and organs in the body. When does all of this really start? Is there a start time? I think I heard Dr. St. Eloi say it really starts at birth, but I'm hoping that's not exactly true as a 56-year-old, but can you clarify for us for that?
Yeah, so Dr. St. Eloi was pretty close. So when we speak, I think what you're asking is more with respect to coronary artery disease. And that's disease in the vessels that supply blood to the heart. And, you know, that disease process, you know, causes the buildup of cholesterol and other material called plaque on the inner walls of the heart. And the process usually starts very young. You know, there's recent data that shows in adolescence, you already start developing what we call fatty streaks, or you can see evidence of plaque buildup in the vessels of children as young as 10, 11 years old.
Oh, wow.
So, you know, before your teen years is really the answer. But also, like Dr. St. Eloi said, coronary artery disease happens in everyone. And so, you know, the speed at which it develops differs from person to person, but we all have some degree, some stage of coronary artery disease. And our job as physicians is to prevent that from causing complications. So the disease itself is not going to hurt you or kill you. When it progresses and when it starts limiting blood flow, or when the cholesterol plaque breaks, is when we really have issues. And that's what our preventive strategies and our medications and et cetera, that's what we're trying to do, is prevent complications from that.
Awesome. So thank you for that and for clarifying. So then if we go back to Dr. St. Eloi, because what I think I've heard and what I think our audience has heard is this issue really, even though we tend to talk about it as adults, and as adults, we might get sent to a cardiologist, really from a prevention strategy, we need to start earlier. And as a people, we need to hear that earlier. So as for you, Dr. St. Eloi, who, sees general medicine practice, and I know right now you're with Chen Medical on the senior side, but what are some of the things, what are the conversations we should be having with our children, or what should we be doing to keep our children from having some of the complications later when they get to be maybe our age, and some of the things that, they should be doing now for our children, our teenagers especially?
That's a great question. Even though I focus on geriatrics now, my core is in full spectrum, right? So from cradle to the grave. But the biggest idea is to start early, right? We don't realize how much damage we do early on and how much it has an effect on when you get older, right? You chronically hear, older patients saying, man, I wish I took care of my knees when I were younger, right? I use that because it's such a great way to look at what we've done in the past and how much it affects us in the future. And so the things that we eat, so diet is a huge, huge, huge factor when it comes to, decreasing your risk for cardiovascular health, right? So if my diet is consistent of potato chips, chicken wings, if we're looking at the things, soul food, macaroni and cheeses, the mashed potatoes, the things that make our heart whole, right? The good things, these things have to be taken in moderation, right? I'm not saying not to enjoy yourself, but it comes at a toll, right? If these become our everyday meals 3 times a day, 7 days a week, these have long-lasting implications, right? So when we're younger, our metabolism can take a lot of the beating that we're doing, right? But over time, it begins to slow down. As it slows down, 1 pound turns into 2, 2 turns to 5, 5 easily multiplies into 10. And now that increases your risk of something called metabolic syndrome, right? So now you get into a higher risk factor, but now your cardiac is at risk, your cholesterol is at risk, your end stage organs, all the big name things that have all the nice specialties that everybody likes to go to all become at risk. And so earlier work, exercising daily, increase hydration with water, non-sodas, non-juices, things that's going to give our body the nourishment and the fluid that it needs to function, right? Giving ourselves the basic nutrition to get through our daily activity. The way I like to look at it is you don't go buy a Benz and a Lamborghini and go and put regular gas in it, right? No. You go and you optimize the gas, you put the best oil in your car, you put the brand new tires in it because you value that car.
Okay.
But let's look at our body as that car. How do we value and take care of our body? We're talking about meditation daily. We're talking about picking the right foods. We're talking about exercising daily. Treat our body just like that luxury car that we covet so much.
Excellent. Well, those are some wonderful tips, not only for our young people, but for us adults as well. But certainly I like that key where we're going to start earlier and really help to set a good foundation for our young people. And so building off of that, Dr. Dapo, I know you're interested particularly in preventive cardiology. So what are some of the strategies that you would recommend? I think I heard some with Dr. St. Eloi, but what are some of the preventive strategies that you would recommend for us to really combat some of the complications, since we know this might start earlier than we thought? What are some of the things that we could do? And perhaps maybe you'd want to comment on some of the major contributing factors of heart disease specifically that we could address?
Yeah, so I'll start with the second question, and we've touched on this, and a number of us have kind of commented, but I'll just kind of summarize. So I like to think of the causes of cardiovascular disease in three different groups. One, medical conditions, high blood pressure, diabetes, high cholesterol, high blood sugar. And one that we forget about is disordered breathing during sleep, or sleep apnea. These are medical conditions that contribute to the development of heart disease. And then we have lifestyle factors. So we have unhealthy diet, inactivity, unhealthy weight, smoking, too much alcohol, emotional stress, another one that we forget about, recreational drug use, and then we also have some medications like hormone replacement therapy or birth control that can cause, in some people, clotting disorders, especially if they're prone to developing clots. And then lastly, there are risk factors that we can't control. One, our sex. So men have a greater risk than women, but women's risk changes over time. So women's risk doesn't stay low forever. After menopause, women's cardiovascular risk actually reaches that of men. Age is something that we can't control. And that's, older people have higher risk than younger people. Family history and genetics, South Asian descent, African or Native American descent, and then personal circumstances. And this is a whole nother topic in itself. And that's including access to healthy food, safe drinking water, health services, social services, these social determinants of health. And many of them we can't control, but we can try our best to manage them. And so with regard to preventive strategies, if we look at all those risks, there are a million things we could do. But I think the easy things to do, early on, as young as, in your teenage years or younger, is really have a primary care provider that is seeing you regularly, and really to take control of your health. Don't push it off. Don't ignore it. A lot of times we like to ignore things until they cause problems or they limit us from doing what we like to do. I'm guilty of that as well. But really take control of your health early on. Increase physical activity, and a little is better than nothing. We know that those individuals that increase their physical activity from 0 to 10 minutes a day or 15 minutes a day actually see a greater increase in their life expectancy than those people who increase from 60 to 80 minutes a day.
Wow.
So just getting off the couch really does a lot for decreasing mortality or in other words, increasing your life expectancy. And then eat more healthful foods. And what that means is, the American Heart Association recommends that we consume, a variety of fruits, vegetables, grain products, especially whole grains. Choose fat-free or low-fat dairy products, legumes, poultry, lean meats. One thing that I learned early on was, I like to make spaghetti with meatballs, and I buy ground beef. And I never looked at the package before, but on the package, you'll see they actually have a fraction on there. It's 85/15, 90/10, 70/30. And that's the lean part that we're talking about. So that top number is what we mean by lean. And really, you should be buying meats that are 90% lean. And then try to eat fish, preferably oily fish, salmon, at least twice a week. And so, those are things that you can do tomorrow to reduce your cardiovascular risk. And then, when you see your doctors, you can work on the other things.
Excellent. I appreciate that. So Dr. Olivier, I have a question for you, and it came through the chat. When we talk about doing things in moderation, I guess, especially from a diet standpoint, what does it exactly mean? Or from an alcohol standpoint, what does that exactly mean? I've often told people if you can't measure things out, using the palm of your hand is considered a pretty good idea in terms of portion sizes. But if we had to be a little bit more specific, what is it that you would say to our listening audience who posed that question?
I think portion control is, everybody wonders what is moderation. That's a good question. I think alcohol is pretty easy. For males and for females, I usually say, depending on the gender, depending on the body size, to 1 to 2 drinks if you're going to be regular drinkers. Preferably not regular drinkers, but 1 to 2 drinks would be the limitation. Drinks by I mean it's a glass of wine, maybe an ounce or 2 ounces of alcohol. When it comes to eating, I tell all my patients, the labels say a lot, so ultimately, yes, you want to eat, don't eat past being hungry. It's very easy, especially in America. I ask my family members and I look at old pictures of them and I say, hey, what's going on? You was like real slim. And they said, we came to America because there's food everywhere. And when you're in other countries, it's not the case. And, it's a kind of a painful realization because it's the case. You're hungry, you want to eat at 2 a.m. You can go find someplace at 2 a.m. to eat. So eating during regular time periods, eating, like you said, controlled portions. Carbohydrates are large chained sugar foods. So foods you will hear oftentimes primary care and ourselves say, foods that are white, stay away from it. Your potatoes, your fries, your rice, and rice is such a staple food. If you also pay attention to it, they're one of the cheaper foods to do. They fill you up in places that, especially in communities that don't have as much they can't afford, having the nicer, healthier option. So you buy bags of rice, you buy bags of potatoes, things that's going to keep the family full. But it comes with a caveat. You're also filling yourself with carbohydrates, which comes out in calories. And if anything in excess, your body will store it as fat. So, I think it's important to keep those aspects of, hey, certain portion control and moderation for carbohydrates, definitely alcohol, definitely, lifestyle factors like don't smoke, things like that are important, but also tailoring it to each patient. Some patients eat less than others. Calorie counting, keeping an idea of what exactly you're putting in your bodies. I always tell patients, especially with cardiology patients, if it's sitting on the shelf and it's not frozen, it likely has something that's preserving it. And usually anything that tastes good or tries to taste good is controlled with 3 things. You're going to be salt, fat, right? Or sugar. I actually challenge you, if you see 2 products, one's low fat, one's low salt, see how much the salt and fat content is changed between them. And you'll see that to get that taste out of it, they have to alter something. So you have to tailor each, not only portion, but even the type of food to each patient. Hypertensive patients or heart failure patients require a different type of diet. And that also means portion as well.
Okay. Those are really practical tips. And I think one of the things that I think I heard you say is we can use some of the foods, but use them differently. So for me, I'm just going to share with myself, like I love some black eyed peas or collard greens, but I can cook them differently and watch my portions of them and maybe not have them as often. And that would be a moderation effect for me, correct?
Yeah. And sometimes it's not also as much, it's also as often.
As often. Excellent. Excellent. Good. So let me ask you a follow-up question, Dr. Olivier. You are interested in invasive or interventional cardiology. And so I'd like for you to talk to us a little bit about what cardiac catheterization is in terms of a treatment. But before that, if you could share, there are data that show about 50% of women leave emergency departments without a correct diagnosis related to their heart. It's either inaccurate or misdiagnosis. They think it's something else. Can you maybe share with the audience why that is? And then as a follow-up to that, talk a little bit about cardiac catheterization? Yeah,
sure. So medicine is one of those very, very rare circumstances where it's okay to have that kind of bias or idea or thought process behind a certain type of individual. critiquing and probably biased in different cultures or different circumstances. But for us, we have to keep that in mind, especially as clinicians. For example, women oftentimes present atypically. It's not uncommon for someone to say, I feel short of breath, and that is a heart attack. It's not always chest pain. Sometimes people you come in with back pain. Sometimes people come in with jaw pain or leg pain or arm pain. Some people don't come with pain at all. Some people complain of nausea. The heart shares such a variety of different senses with different neighboring structures, and it has been shown that women sometimes present atypically. So that I imagine may be the cause, because not all the time are you met with a cardiologist in the beginning in the emergency department, right? Come into a hospital because something's affecting you, and the first person you meet is going to be some personnel, if not the emergency doctor themselves. And a lot of that comes with, they're managing everything from flu to abdominal pain to strokes. I mean, there's a lot to handle on plate. And sometimes when things don't come out to stand out atypically or typically, it can be a diagnostic dilemma sometimes. So I imagine that might play a role in that. Now, in discussing, and I think the other aspect, and not just with women, is just in general, it depends on how much you're willing to kind of share with the provider that is on the other side. We're not there in the business of hurting patients. That's part of our oath, to do no harm. But we need to know even the parts of or the answers that you're kind of reluctant to share. When do you feel this pain, even if it's or this discomfort, even if it's kind of an embarrassing moment? We need to know these things because it kind of gives us a better idea of what's going on. Now, to follow with heart catheterization, that's a procedure. Well, it's a diagnostic procedure and also an interventional procedure at the same time. So usually, to get to the point of a heart catheterization, you have to either show some concern, not only just for a heart attack. Like I said, the heart is a house, right? It has a plumbing, it has an electrical system, it has doors, it has valves, it has walls. And if there's something that's compromising any of those structures, it can lead to a heart catheterization. And heart catheterization is simply, we take a wire and we kind of get access to one of the vessels. Remember, it's a cardiovascular disease, so all roads lead back to the heart. And if we can get access to a vessel, usually through the wrist, we can use the artery in the wrist, or we can use the arteries in the groin, and we use a wire to track back to the heart. We'll use a catheter, which allows us to inject a dye or a contrast, so we can illuminate the heart, if you will, under X-ray imaging, and then we can see the vessels light up. And that helps us not only diagnose if there's coronary artery disease, because we're actually visualizing the vessels, but it also helps us to intervene, which is where interventional cardiology comes in. And it allows them to deploy items, for example, such as stents, which looks like little tiny Chinese finger traps that plop open and relieve the obstruction and restore blood flow to the area. And it also allows us to not only intervene in the vessels of the heart, it allows us to measure the pressures of the heart, measure the oxygen levels in the heart, to help to determine if there's pressures high in the lungs, or help us to determine if there is a valve that is tight and not operating the right way. So it tells us a lot about the entire house as a whole, which is why it's very crucial or a critical test, but it's not without risk. So usually we use that and reserve that for the extenuating circumstances, or when our diagnosis and our diagnostic tests are kind of leading us in that direction.
Excellent. And I might imagine, Dr. St. Eloy, as a primary care physician, you work very closely with the specialists like the cardiologist. But a lot of people in our communities, and maybe even in the listening audience, sometimes don't understand why you'd need to see a primary care physician for your heart, as well as a cardiologist as a specialist. So can you talk a little bit about why some of those relationships might be important, how you can encourage us to do that? And then one of the other things that I know that the audience is wanting to understand is how are we affected differently or adversely based on ethnicity or heritage?
Well, thank you. That's a multifaceted question with so many different avenues. But the number one thing is I encourage everyone to have a primary, right? sometimes we get inundated with so many information. We need someone to look at all the information on the table and to be able to bring it back home, right? And a lot of times people get some of their primary care needs with their specialists, but unfortunately, they're specialists for a reason. They spend extra time and really harnessing their craft and being really great at what they do.
Mm-hmm.
And so to me, it's almost like I like the car example because it's so very easy to understand, right? I'm not going to bring, you know, a Lamborghini to a Toyota dealership, right? Because I want people who actually know how to fix the car, who really know the ins and outs and everything that the car needs versus, oh, I'm going to save money and go to Toyota, but they're going to put Toyota parts in this $500,000 car, right? And so when I look at my specialists, these are Lamborghinis, right? They have really done everything they needed to do to learn exactly how, in this instance, the heart functions, right? And so that's what they spend majority of their time into. And so they may be looking at the heart and they know the heart is affecting other vessels and they know it's affecting the kidneys, but their idea is the heart. They're smart. They know that there's other things going on, and they do exactly what they need to do to make sure that not too far things go out of whack. But it's more than just your heart, right? Because if your heart goes out of whack, then it's your kidneys, then it's the vessels in your legs, right? And then
Right.
it's your skin changes. Oh, you know what? Your heart is really related because your thyroid is out of whack. Oh no, it's not just your thyroid, it's your calcium. Oh, your
Gotcha.
calcium's out of whack. Oh, it was the kidneys, right? You need somebody to take a step back and look at a 3,000-foot view to
Excellent.
really gather all the information you need to make the best determination possible.
Excellent.
Specialists are amazing, but it's in communication with your primary care, and then all three of you can make the best decision, right? The reason why I say all three is because the patient is the most important person out of this whole entire thing, right? We are only as good as the patient that comes to us, right? Everyone needs to take accountability and ownership of what's going on to them. A lot of times we go to the primary and we just say, whatever you say, doc. Not really, right? I may say something that doesn't necessarily bode well for you, right? If I tell you, hey, I don't want you eating chicken anymore, you say whatever you say, doc, then you go home, eat chicken anyway, right? But instead, just say, hey, doc, that's not something that I actually can do. Maybe I can do it about 2 days a week, doc. Now we're working together, right? Medicine is a partnership. It's not a unilateral decision. It's a partnership that you're making with your primary and your specialist to optimize your health. And that's the ultimate goal, to live a better, healthier, safer life. And
Excellent.
then you made another question about just about your risk
Ethnicity.
factors and your
Mm-hmm.
ethnicities,
Mm-hmm.
right? There's a lot of studies that talk about what it looks like. And I don't want to say one thing or the other, but I would say, you want to have, a physician who understands your cultural diversity and how that impacts your life. Because your heritage, your genes, and where you come from makes a huge impression, right? If you're African American, 9 times out of 10, you're probably going to have some type of salt sensitivity, right? And salt is going to shoot your blood pressure all the way out, and you're going to have fluid retention issues. And that increases your risk of having heart failure and all the type of cardiovascular mishaps that can happen, right? Because our genes and the things that we are made up of, we cannot change, but we can adjust. We can adjust, we can understand, and we can make a plan to optimize.
Oh, I love that. So what Dr. St. Eloy just described is what I like to call a culturally competent healthcare provider. This audience has heard me say that before and so many others. And that's not always about gender or ethnicity or any of those things, but as he stated, somebody who really understands who you are. I saw a very healthy conversation going on in the chat. So I'm going to ask Dr. Dapo just a little bit about COVID, which is a virus, and heart disease, because I think that, so many in our communities and our communities of color have missed some opportunities related to that. And I want to encourage us to get the correct information. But we know as healthcare providers that COVID can attack the heart. It is a virus. So perhaps you can speak a little bit about not only COVID, but maybe viruses in general, inflammation of the heart.
Great question. We could go a number of directions. I guess I'll start with viruses in general. So the way that viruses, prior to COVID, we still got viruses, and in the hospital, any of us physicians can tell you that we see really sick patients who come in with conditions related to inflammation from the viruses. And the two main ones that we see are called myocarditis, which is inflammation of the actual muscle of the heart and causes it to become weak, which ultimately leads to the syndrome known as heart failure, or pericarditis, which is the virus inflames the sac around the heart, and that can cause the lining between the heart and the chest wall to become sensitive. So people oftentimes will complain of pain initially with deep breaths or with lying down. And that can progress and cause fluid to build up in that sac and can really compromise the function of the heart. COVID-19, just like every other virus that we know, can cause myocarditis and pericarditis. With regard to the rates of COVID-19, I won't quote them because the range is so vast between studies that it's almost, it almost doesn't matter compared to your routine virus that you get from a child in the home, or you get every winter. In general, people with heart disease are more likely to experience symptoms and complications when infected with viruses, especially COVID-19. And one thing that I do want to mention is that people with heart disease don't have a higher chance of contracting the virus, but they have worse outcomes. So heart disease doesn't increase your chances of getting COVID, but if you do get COVID, you have a higher likelihood of doing worse than someone without heart disease. A recent study actually just published a few days ago in Nature looked at what happens after you recover from COVID. And they saw that beyond the first 30 days, individuals with a history of COVID infections had an increased risk of having their first cardiovascular related event. And that spanned a number of categories, including strokes, abnormal heart rhythm, coronary artery disease or related conditions, pericarditis and myocarditis, like I mentioned, as well as heart failure and clotting disorders.
Wow.
So I think, with COVID-19, the most important, I guess, take-home point is really, if you have chronic conditions, if you have especially heart disease, that you get vaccinated, that you wear a mask, that you are aware of the symptoms, and we may talk about those symptoms later, but that you're vigilant of symptoms, that things may not be going so well, and that you see a medical provider, soon. And yeah, I think that's pretty much it.
You got a hand clap for me, because I am a proponent for those who are able to definitely get vaccinated. I do think there's enough information. We know that it is safe. There was a comment or question in the chat with regards to pregnancy and preeclampsia, so hypertensive disorder. So as an OBGYN, I'll answer that one. Absolutely, it places you at long-term risk for cardiovascular issues, largely hypertension. And so if you were diagnosed in pregnancy, you absolutely need to make sure that you get connected to your primary care physician, like Dr. St. Eloy, who may need to refer you to one of the specialists like Dr. Olivier or Dr. Dapo. So absolutely. And for those who need more information, you can please reach out to any of us. I'm going to ask the gentlemen to please put their contact information in the chat. So if there are follow-up questions, because I can't even believe it. We've been sharing now for almost 45 minutes. At least seems like it was like 5 minutes ago that we started sharing. This has been outstanding information, but I'd like to just give you each 30 seconds to give your elevator speech in terms of how we as your listening audience can really maximize our heart health. And we'll start off with you, Dr. Olivier.
Okay. Well, I think the first thing to do is to find your local primary care provider. They are the captains of the ship. We were just rowers, and he calls upon every one of us when he needs to. But the only way to know if there's a cardiac issue or something that may lead to a cardiac issue or other organ issues is to find your primary care provider to initially do those routine checkups. I'd say number two is to identify that we're here for you, and we hope that it's a partnership that we can work on. Everyone's going to have homework. The provider is not alone in this, and they cannot prescribe a medication without having the patient understand that there's a great responsibility in taking that, and in addition to lifestyle factors. I think knowing yourself and sharing that version of yourself to your provider so they know, hey, I just can't stop this. Is there anything we can do so we can work together? And also realizing that there are differences, gender differences, there's differences, ethnic differences, age differences. And to touch on being in a specialty with pregnant women, I'll say that unfortunately, I had recently had a patient who was kind of brushing off their own health conditions, and now is actually in the critical care unit because no one was there to diagnose something that now is actually at risk for her and her babies. So it's just important to acknowledge that, hey, you know what? Medical conditions are going to happen. Let me see a primary care provider. When I do see the primary care provider, let me be open to working with them and being able to share the information that we all need to help make a healthy exchange and prolong health.
Excellent. Thank you, Dr. Olivier. Dr. St. Eloy, can you give us your pearls of wisdom for our audience and our heart health, please?
Once again, just thank you for having us. I mean, I couldn't have said it better than Dr. Olivier. I mean, everyone, no matter who they are, find a primary care provider that you can trust in. Trust is a huge factor when it comes to medicine. I don't think medicine has always been on our side when it comes to dealing with the African American or minority community, but now is the time to build trust. We're having more and more physicians who do primary care who look like you, who think like you, who are from some of the similar cultural backgrounds and cities that you're from. Find them out, support them as that they can support you. Start early and often, right? Nothing is too small. If you went from zero activity, 10 minutes a day, 5 minutes a day is better than you were a week ago. Celebrate the small goals. Each goal is important.
Excellent.
If it's smoking and you're smoking 20 packs a day, celebrate 19 cigarettes. Celebrate 18 cigarettes, right? Have a big celebration when you throw the pack away because your bank account is now better,
Yes.
right? It's these small goals that we can do every single day. Sometimes we think we have to do them all in a bunch, but one small victory a day can mean a lifetime of change. It can mean 5, 10, 15, 20 years added to your life, right? By doing one small change a day. Dr. Dapo mentioned, you had an increase of life expectancy just by adding 15 minutes of activity a day, better than someone who was working out for an hour and a half. That's staggering information. That means just getting up out of your bed, doing something active can save you years on your life, right? That's valuable information, probably more valuable than anything that we've said today about getting up and being active. And so use those tools, find the small victories, celebrate the small things, and I think that would be my takeaway.
Excellent. And Dr. Dapo, I don't want to crucify your name at the end of the night. So
No, no, it's okay.
I'm going to call you that. Why don't you share us your elevator speech for us and our hearts?
Yeah, so a lot of it honestly has been said, but so what I'll do is I want to focus on two groups of people. One is women and Black women. We know that African American women are 60% more likely to have high blood pressure when compared to white women. We know that Black mothers are 3 times more likely to die in childbirth than white women. And heart disease is often thought of as something that affects men. And so, I really want to implore, we have many women in the audience, really, think about, taking control of your health, finding out what risk factors you have, finding a primary care provider that you trust, and someone who finds those things important and doesn't ignore those things, someone who's able to identify how disease processes develop in women different from in men. And I also want to really address the starting early. Childhood obesity is one thing. It's probably, honestly, probably the biggest predictor of your future risk. When we look at how early children are developing obesity now, and that leads to high blood pressure at younger ages. It leads to diabetes at younger ages. The International Stroke Society conference is going on right now, and they presented research that showed that younger people are having strokes at ages that we've never seen before, at a rate that we've never seen before. And so, right now we're dealing with diseases of abundance in the Western world, in the industrialized world, whereas before we used to deal with starvation and dying of starvation and those issues. But now we have a lot, and we need to, really take control and start early, like everyone has said on this panel. The earlier, the better. It's never too early.
Excellent. Well, I want to thank you 3 gentlemen, you distinguished doctors, for joining the panel tonight and for allowing me to moderate. Lakeisha, this has been just a wealth and breadth of information. And I particularly am impacted by the fact that it comes from providers who look like me. And I think that is really important. Someone mentioned in the chat how trust is so important. So I'm going to encourage all of us. These gentlemen have put their information in the chat, that you take pictures of it or save it however you need to save it. But our hearts do matter. And it would be really a shame during Black History Month not to take care of ourselves. So I always like to tell people that self-care begins with self. We tend to take care of so many other people, but we do need to take care of ourselves. So let's start with those of us who are on the call. Know your numbers, do the small things we've heard. It doesn't take like a mountain. We can really start small, but do it under the care of a provider who cares about you. And that's really what I think self-care is all about. And then your heart naturally will follow. So again, thank you all. Thank you, Lakeisha and Dreff, for allowing us to be here. I think this has been a really informative, wonderful, educational experience.
Thank you for
Thank you for having us. Thank you.
Let's give our panelists another hand clap. And I am going to let our community engagement coordinator, Dr. Kay Dawson, close us out on tonight. Again, I thank all of our partners, the ladies of Alpha Kappa Alpha Sorority Incorporated, the ladies of Top Ladies of Distinction, our wonderful healthcare providers, Chin Medical, Baptist Health, Memorial Medical. We thank you so much for being with us today. Of course, our partner, University of Miami, the Enrollment Center for the All of Us Research Matters program. And I will tell you, all of the information that you gave us was wonderful. It was everything that I thought it would be. And one of the best parts of the night was my son, he came over, he's 6. He came over for me to help him with his homework. And he looked at the screen and he said, "Mommy, are all of those doctors?" I said, "Yes, they are." He started trying to read your names on the screen. Representation always matters. And I thank you all for accepting our invitation on tonight. Dr. Dawson, will you close us out, please?
Good evening, everyone. I want to allow Peyton Terrell is on tonight, and I want her to actually close us out. But I do want to say thank you to all of the docs and to everybody that has come on tonight to share. Dr. Dapo said that there is a conference going on, and there has been some research done on certain persons about certain issues. And the question on the table for me tonight is how much research or how much of that particular research were we included in? And that's what this is about tonight. The reason that we're doing any of this and all of this is to invite all of you, after the education and after being engaged, is then to move towards enrollment in research. Because as I say all of the time, my body is made nothing like a 55-year-old white male. Neither are your bodies. And so we want that representation at the table. Please go to Join All of Us and sign up and be a part of this research. Please help me welcome to the spotlight, Miss Peyton Terrell, an amazing gift to DREF and to all of us. Take it away, Peyton.
Thank you so much for that introduction. Hello, everybody. I am Peyton Terrell, and I serve as the Community Engagement Assistant and Social Media Coordinator for the DREF Research Matters for All of Us initiative. On behalf of DREF's Executive Director, Ms. Cheryl Thomas, and the entire Research Matters team, including who you just heard from, Dr. Kay Dawson, who is our Community Engagement Coordinator, I would like to thank the community partners, the speakers, our Miami Citywide Coordinator, and her volunteers for putting on such an amazing event. I would also like to thank all of you for tuning in. As mentioned earlier, precision medicine is the future of healthcare. Our community, the Black community, has been left behind in so many aspects, and we simply cannot afford to miss an opportunity to contribute to something as important as precision medicine. So I invite you to learn more about the All of Us Research Program. The All of Us Research Program is building one of the most diverse health databases in history. And luckily for our community, researchers will use the data to learn how our biology, lifestyle, and environments affect our health. This may one day help them find ways to treat and prevent disease. So for more information about the All of Us Research Program, please visit joinallofus.org/DREF. Again, that's joinallofus.org/DREF. That's all.
Thank you.
Be on the lookout for our pop-up clinics. That's going to be a day party that's coming in March, April, or May. And we're going to be signing up everybody that we know for research, but we're going to do it by having a great time. So listen out for the pop-up clinics and get ready to really enroll and be a part of what we're doing. Thank you again. Thank you, Lakeisha and the Miami team. You all are rocking on all cylinders, I'm telling you. Great job. Great job.
Team. They always have my back and I love them dearly. Well, thank you all for sticking with us. I know we usually try to have you out by 8:15. You all are still here with us at 8:45 and I appreciate you. Have a wonderful night. Please feel free to reach out to us if you have any questions, and remember, joinallofus.org. Thank you.
Thank you. Have a good night.
Good
Good night. Thank you. Good night,
Good
everyone.
night.
Good
Good
night.
night. Good night.
Good night.
They stuck with us.
Thank you, Dr. Anderson. Great moderation.
Thank you. I know your recording is still going.
Oh.
Oh, thank you, because I was